All right, good morning, everybody. Dr. Nasathari, you can please get started.
So thank you so much for allowing Nicole and I and our team to join you, colleagues in the media. Um, Clearly, Windsor-Essex has suffered disproportionately related to COVID-19. The burden of disease, as evidenced by the number of cases, the percentage of people who are testing positive, the number of people self-isolating, all suggest that COVID-19 is a significant burden to the community. Today, the Public Health Service will be sending out a letter of instruction, and that letter of instruction will require that all people who are age 12 and greater who attend recreational facilities show proof of vaccination. So again, what we're trying to do is that trying to improve the safety of the community, and this public health direction will require all people over the age of 12 who present at a recreational facility to demonstrate that they are vaccinated. That'll include coaches, trainers, people that are officiating, and we hope that that'll be one incremental step to improve the safety of the community. I want to share with you that there are still tens of thousands of people in the health district who are currently eligible for vaccination and are unvaccinated. Vaccination is an important strategy to control COVID-19, and we encourage all people who currently are not vaccinated to become vaccinated. So with that, if Nicole wants to supplement that in any way, and if not, we can go to any questions.
I think we're ready for questions.
Okay.
All right, any questions from CBC?
Yes, good morning. The letter of instruction, does that just apply to recreational facilities outside of schools or inside of schools as well?
Nicole, do you want to just answer that or respond to that?
It's the letter of instruction is for organized sport and recreation facilities. So as per the ROA, the Reopening Ontario Act. So it's already defined within the Reopening Ontario Act, and schools are not part of that definition. But we do have separate recommendations that we have already provided to schools, and will continue to work with schools around those recommendations.
Thank you. And I also wanted to ask about the statement you issued on Friday regarding informed consent and youth vaccination. I know that's it's been the health unit's position all along that anyone over 12 can consent, but I'm wondering why it was important to reiterate that message, and what is your message to those in the community arguing that parents should have the final say?
So go ahead. Do you want to comment first, Nicole, and I can supplement that, or go ahead?
You can start, Dr. Necessary, and I can supplement.
So the first thing is, this is a broader issue. I think that everyone who has children, everyone who's a parent, recognizes we need to have dialogue with our children, just not about vaccination, but with healthcare overall. Young people go to the doctor all the time without their mom and dad. And so part of making the transition to adulthood, and all parents want their children to make the successful transition to adulthood, is to allow them to make decisions that are within their ability and their scope. So, I think that's the first and most important issue. Secondly, in medicine, in general, the current view is that there's no clear cut point for when you can give consent or not. The real issue is, can you really understand? If you can understand what the nature of the treatment is, and you can understand the risks and benefits as a general construct, you can give consent. That's not really different from the rest of medicine. And so when we think about vaccination, it's part of health, about the management and provision of health services for young people and all people for that matter. The context of that statement, I will ask Nicole to comment on. But really, I think that those to parents that might have concerns about this particular element, I think the most important thing is to talk to them. Talk to them today. and talk to them about making health choices, because not every health choice, mom and dad will be there to help you. If I could share another public health choices, there are choices like smoking or not smoking, using drugs or not using drugs, drinking alcohol or not drinking alcohol. Those are all choices young people make without, many times without mom and dad. And so, to me, I think the most important thing about this debate or this dialogue is about having discussions with your children and having honest discussions with them about health status. So, sorry for being long-winded on that, but perhaps Nicole, you can talk about the more specific issue.
Well, yeah, I think we felt it was important just to clarify that, with everything that we do within healthcare, we follow the Healthcare Consent Act. And as Dr. Nathuri pointed out, there isn't a clear, cut age legally. And what it recognizes that individuals have the right to make decisions about their healthcare, and consent is part of that. And so even in the case of like a school clinic, we do work with the schools. Notification is sent out to parents, so that's really important. It's important that the school community knows that we're there. And we do encourage that youth talk to a trusted adult, their parent or legal guardian or another trusted adult in their life. But at the end of the day, it's the healthcare practitioner who is working with the client, the patient, whether it's the youth or anybody else, that does go over consent and confirms that they do understand the risks and benefits, and obtains that consent. So even in the cases where parents, have, say, told their children to get the vaccination, it's still our requirement to confirm with the youth and ensure that we have their consent. So again, they're complex issues, but one sort of narrative that we were aware that was going around is around the health unit, coercing people or coercing youth into vaccination. That's certainly not the case. We have a walk-in model, just like all of our other clinics. We do put out notifications. We're there available just to answer questions, and certainly for those who want to have their vaccination, who haven't yet had one, and they're eligible and they are capable of consent, then it's an opportunity for them to be vaccinated, and that applies to families, students, and staff.
Thanks very much.
Any questions from Blackburn?
Yes, I just wanted to ask about the letter of instruction going out about recreational facilities showing proof of vaccination for those 12 and up. Some of the towns have already put out some direction already, and they've exempted spectators. Does this include spectators, your letter of instruction?
Yes, it includes all individuals, whether they're spectating or supporting or participating.
Okay. I think that's it for me for now. Thank you.
Okay. Any questions from Windsor Star?
Yes, good morning, Nicole, and good morning, Doctor. Let's see here. For the letter of instruction, will there be alternative options for individuals who don't want to get vaccinated in terms of testing requirements?
No.
Okay. And I wanted to ask about in-school vaccination. Is the system happening right now for COVID-19 vaccines any different than the system that the health unit offers for other routine in-school vaccinations, where you would tell the parents, school community ahead of time that you'll be there offering, say, the Hep B vaccine or HPV vaccine?
So our process is no, not really that different. When we put out notification for our ISPA vaccinations, so those are the provincial vaccinations, and then we also have school screening for oral health. So there's a number of health services that are brought to the school. Some cases will use active consent, in some cases passive, where we'll put out notification. But at the end of the day, the important thing to remember is whether we're getting active consent from a parent, whether they're signing, or it's passive notification. At the end of the day, the consent is still upon still upon the person who's receiving the treatment. So in that respect, it's no different.
Do you have any numbers to share with us of how many youth were vaccinated at St. Joe's and Kingsville Public School when you offered the clinics last week?
I won't be able to give you exact, but I think for St. Joe's, it was around 20. And in Kingsville, I don't have the number at top of mind.
Okay, thank you.
Any questions from AM 800?
Nicole, Nicole, I think this is more for you. When does the letter of instruction go into effect?
So that'll all be included in the release, but it'll be there'll be just a few days certainly for notification, but we'll finalize the date when the release goes out.
So I just want to make sure I have it right. So if you're basically 12 and over heading into any recreational facility in Windsor-Essex, you need to be vaccinated.
Yes.
And one final one, Nicole, last week you told us about the enforcement blitz with the province. I know it's early Monday morning, but do you know how that went over the weekend?
So I've been email hounding the team to see if we have an update on how the blitz went over the weekend. I can, and they've said Wednesday. We'll give you a really clear update Wednesday as far as observations related to compliance and education for different settings. So I promise you we'll bring that on Wednesday.
Thank you.
Any questions from CTV?
Yes, good morning. Does the health unit letter of instruction overrule all of the other municipal policies that have already been put in place in Windsor and Essex County?
Yeah, so go ahead, Nicole.
Go ahead, Shanker.
So we're not lawyers, so we can't comment on the legal framework, but I could share with you my understanding. My understanding is that when the public health instruction is put forth, everyone is required to comply. And as a practical matter, I would expect that local municipalities would follow the direction of the letter of instruction. They may change their practices to make them consistent with the letter of instruction. I think that municipalities would probably find the letter of instruction beneficial to the extent that it streamlines the process. So I can give you a concrete example. Many times when people go to a hockey game, they're playing in one game and watching the next game. And this policy makes it much easier to streamline that so that they don't have to make an arbitration decision about who's a player and who's a spectator. But I don't anticipate that that there will be any challenges with adherence as it relates to municipalities and county local government.
Okay. And will you be adding extra enforcement to when this rolls out?
I wouldn't say extra. We don't really have extra enforcement, but as far as over the next, past week and over the next few weeks, our enforcement efforts will be more focused on, the vaccination verification and certification program. Again, as I've noted before, we want to ensure that it's being implemented, that people understand it, and that there's good compliance. So with any new change, we tend to focus our efforts a little bit on those changes to make sure we're supporting businesses, but also ensuring that we have information that it is being adhered to and implemented as it's intended.
Okay, thank you. And as far as the vaccination rate for the region, are you satisfied where it is right now? Or where is it compared to where you want it to be?
Well, I think there are substantial opportunities to improve the vaccination rate. I know I repeat myself, but if you are vaccinated, you're less likely to get sick, you're less likely to get infected, you're less likely to transmit the illness to other people in a population health level. So getting vaccinated is likely to help you as the person getting vaccinated. It also diminishes the burden onto the healthcare system. For the most part, the most severely ill people with COVID now who are being admitted to the hospital are the unvaccinated. If we can conserve hospital and healthcare resources, then we can shift some of those resources to those other disease states than COVID-19. So you're helping other people. What is the exact number that gives you the greatest population health benefit? Well, the more people that you have vaccinated, the better, for sure. If I had to set a subjective goal, it would be 90% or 95%. We're far from that. It's particularly important in schools because one of the most important public health goals is to keep schools open. And if we have a higher vaccination rate, we can have perhaps the option of taking less assertive steps to control COVID-19. So and Nicole can give the exact number, but I think in some cases for young people between 12 and 18, I think we're between 50 and 60% vaccination rates, which is really far from where we want to be. If I could share a very granular item, approximately 90% of young people are vaccinated against the diseases as specified by the Immunization for School Pupils Act. So that's for diseases like measles, rubella. And our vaccination for young people with COVID-19 is between 50 and 60%. So that's a huge gap. And if we can get the vaccination rate for COVID-19 for school-age young people who are eligible to the same level as other vaccines, then I think we would have achieved a great deal in trying to control COVID-19. So again, I'm sorry for that long-winded response, but I hope that provides some context.
Yes, thank you. Switching gears a little bit, are you concerned with the increase in cases in the LTC and retirement homes, and what is being done to curb this?
So I'll start. We're always concerned when we see an increase in cases in certainly vulnerable settings like a long-term care home or other congregate settings. That does definitely concern us as a health unit. What is being done? I mean, the same things that we've always done. So looking at vaccination rates, working with our homes around their infection prevention and control practices. In some cases, if we see additional cases or there's an outbreak, more measures are put in place in collaboration in conjunction with the long-term care facility in this in that example. And all those measures are put in place to sort of stop transmission, no different than any other setting, like a school or a shelter, et cetera. So, but certainly any increase in cases concerns us.
So Nicole, could you just comment on the booster strategy as well?
Yeah. So we have been. I think we started pretty quickly once the third doses of COVID-19 were announced for long-term care and high-risk retirement settings, as well as for individuals who are immunocompromised. And there's a few other, and that's as detailed in the ministry guidelines. So we have been working with all our long-term care homes around third doses, so ensuring all individuals in long-term care receive their third dose. We have very high vaccination rates with our fully immunized with the first two doses amongst our long-term care and retirement homes. I think we're close to 95% in that group. So we're rolling up the third dose and amongst all long-term care and all retirement home settings, and have been doing so since the end of August.
Great, thank you very much.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
No, thank you.
Additional questions from Windsor Star?
Yes, just one. Do you know if the cases in long-term care and retirement homes were detected through surveillance testing, as I know many homes are doing, or do you know if it was symptomatic testing?
So I don't have the exact details, but we could get you that response later, Taylor.
Okay, thank you so much.
Any additional questions from AM 800?
Doctor, the letter of instruction, is that for community centers as well, or is it just rec centers, arenas, gymnasiums, or could it be a community center?
I think this it's broadly written, so it's it would include, and Nicole, you can correct me, but it would include community centers, so places where young people or people might congregate to play hockey or soccer or other indoor activities. It would include all of those.
Nicole, do you know what time the letter of instruction will be released?
We're hoping for late this afternoon.
Okay, thank you.
And any additional questions from CTV?
No, thank you.
All right. Thank you very much, everybody. Enjoy your Monday, and we will talk to you again on Wednesday morning.
You too. Have a good one.
Thanks so much.
Yeah,
Thank you.
all the best. Bye-bye.